At the beginning of the coronavirus pandemic, Cone Health limited the number of visitors in the hospital to help stop the spread. Now, visitors are being let back in. In today's To Your Well-Being, we're taking a closer look at that change and what you need to know before you go and you bring the entire family, because it's not the entire family that's being let back in. Cone Health's Chief Physician Executive, Dr. Bruce Swords, is joining us. Okay, so today is the start of what's called Phase 4 in Cone Health. So what does that mean, and what should visitors expect when they arrive?
Yeah, thanks for having me on. We are now entering a phase where we're comfortable allowing a support person or a visitor to come into our inpatient facilities to support or visit somebody who's in our inpatient units, including the intensive care units. So that's really the phase that we're entering in as of today.
All right, so let's talk about the updated policy because Cone Health waited to update the visitor policy in comparison to some other health systems. What influenced your decision to wait?
We've been having these discussions for months now, and really we are committed to and focused on safety, period, and that safety for our patients, safety for family members or visitors of the patient, and safety for our staff. So we have taken a very deliberate approach to our visitor policy and really trying to figure out when is the safest and how can we allow patients, family, support people back into our facilities in the safest manner possible.
And I know you said you've been talking about it. I'm sure you're using numbers and metrics and things of that nature.
Absolutely. We have, every day we have meetings looking at the number of patients in our facilities, how many of them are in our COVID-only facility, how many patients are coming through our emergency departments. So we look at those numbers. We also want to make sure that we have enough PPE for our staff and, when necessary, PPE for support people and visitors.
All right, so let's talk about the visitors because we kind of alluded to that the visitor policy has changed, but we also said that, you know, entire families are not going to be let in either. So what is the change?
Yep, we have a policy. Our protocol is to allow one support person or visitor per patient in the hospital per hospitalization. So that's generally speaking for an adult patient. That patient can have a support person visit for their entire hospitalization. We're trying to, again, keep it limited, but allow some visitation. And of course, we have some caveats to the one support person rule. Pediatric patients who are in our facilities, both parents or guardians can visit. And we have some other modifications around the one visitor rule, but in general, it's one visitor per patient per hospitalization.
Right. It's still not back to the everybody in your church group can come and see the new baby that has been born.
That's right. And we've made that as a deliberate decision because we know that that's not the safest decision for everyone involved.
And so what is the process then when a visitor is going to be that one person for that patient when they arrive at the hospital?
So that visitor support person will come into our main entrances in any of our acute care facilities. They'll go through a screening process that includes a temperature and screening questions. And as long as they pass all of those questions and temperature check, they'll be welcomed into our facility. They will be asked, actually they'll be mandated to wear a mask that covers their nose and mouth, and they'll be allowed to go visit their loved one in the hospital.
All right, so what happens, and I'm sure this happens often, that you show up with too many people in the group, right? Or if that person who was designated to be that one caregiver does not pass the screening?
Yeah, first of all, we're going to empathize with the visitor. We know that visitors are there to support whoever's in the hospital, and that patient in the hospital, I'm sure, is eager to have a visitor. So when somebody comes to the hospital and doesn't pass the screening questions or the temperature check, uh, we will have a conversation with them and ask them to go back to their car, and they may need to seek medical attention themselves. If somebody comes in with a group of people, again, we're going to empathize and recognize how much they want to visit the patient that's in our acute care facilities, and we're going to allow just one of them to come into our hospital.
All right, so Green Valley campus, that is for COVID-19 patients. So can you visit someone there, or are there limitations?
Yeah, there are limitations, and the general answer to that question is no. We are not allowing visitors to come into our Green Valley campus because every patient in that facility has the SARS-CoV-2 virus. They have COVID, the disease. And so we're accommodating people the best that we can via uh, FaceTime, Zoom. We're allowing people to interact, but we're doing it virtually. There are situations at the end of life where we allow a visitor to come in to support a loved one.
Okay, and that is something that if that is your situation, you need to be in contact with the nursing staff.
Absolutely. We are constantly keeping family members, loved ones updated about every patient in the Green Valley campus, and especially when it comes close to end of life decisions.